for this opportunity to speak in opposition of this bill. I am an anesthesiologist and I have been for the last 38 years. I've been the chairman of an anesthesia department in Cleveland Memorial for 10 years. I was medical director of their OR for 22 years. I've been chief clinical officer of the Upstate Prison of Health for the last 3. I have seen a lot of changes over the last 35, 40 years, especially in anesthesia. I'd like to comment a little bit on what we just heard. No one here is going to tell you that CRNAs are not well trained. I won't do that. They're well trained advanced practice providers, but they are not physicians. And nothing they do and nothing that they say will change that, short of going to medical school. They say they minimize what they say an anesthetic is. They do not do anesthesia justice. Anesthesia is not just putting patients to sleep and waking them up. Anesthesia is preparing patients preoperatively for what's about to happen with the surgical insult they're about to endure, and it is preparing them post-op so that there's a minimal amount of risk or complications as they proceed through the post-operative course. They talk about surgeons and access. There's no one in this state, surgeon-wise, and we have a letter from the American College of Surgeons Division in South Carolina stating there is no access problem because of physicians unwilling to work with unsupervised CRNAs. Removing the supervision requirement for CRNAs, to use her analogy of a pilot. When you have a commercial jet flight across this country, you have a pilot and a co-pilot. The co-pilot is an experienced pilot and he can fly the plane. He probably has somewhere between 2,000 and 3,000 hours if you're lucky. The pilot, on the other hand, probably has 20,000 hours experience. When things go off the rails, the left engine falls off the plane halfway to Los Angeles, no one in this room is going to state to me that they want the co-pilot flying the plane and making the decision. That is not reality. When you talk about physician supervision, and they have tried to take this and reduce it to an anesthesiologist CRNA issue, this is a physician supervision issue. In this state, the vast majority, well over 90%, probably over 95% of the anesthetics are in a team care model. And team care, from an anesthetic standpoint, is an anesthesiologist, a CRNA, or anesthesia assistant working together to provide care to the patient. That is the most safe version of anesthesia that you can provide. I would like, my time's up, okay, I would like to enter this letter, if I might, read it to the committee. This is from Dr. Steve Fann and Dr. Kevin Delaney from the American College of Surgeons, South Carolina chapter. Dear Madam Chair, we have previously written regarding H4278, which would allow nurse anesthetists to practice independently without any physician supervision. We oppose this legislation because it would be detrimental to patient safety and does not address any public need. In recent hearing before your subcommittee, a representative of the nurse anesthetists testified there are areas of our state where surgeons would like to practice, primarily rural areas, but they do not work in those areas because they do not want to be responsible for supervising nurse anesthetists. We strongly disagree with this assertion. That would be an abdication of our medical and legal responsibilities to our patients. While access to care is a very important issue, there are no areas of South Carolina where access to surgical or specialty medicine is hampered because of the requirement that nurse anesthetists be supervised by a physician. They are more than willing to take that responsibility. Our role as a physician is to ensure that the safest and most expert medical care is provided to our patients. Removing the supervision by surgeon would lower the standard of care to patients that they expect and deserve. Our responsibility is to supervise and medically direct all the care of our patients received from all staff, including nurse anesthetists. This is from the surgeon's perspective.
Would you like to submit that?
I would very much like to do that, and I think we have copies for the entire committee. I'll be glad to answer any questions you may have.
Are there any questions? Thank you.
Thank you.